Welcome everybody to another rendition of Caregiver Conversation. I am here with Haley Kopitz from Physical Therapy and Balance Centers in Brevard County, and today we're here to talk about falls and specifically how it relates to concussions. And welcome.
Thank you. I'm so glad to be here, Beth. I'm really glad that you guys are doing these. I think it's super important to share all the information with everyone. So let's get started on the presentation. So like Beth said, I'm from Physical Therapy and Balance Centers. There are plenty of locations around Florida. I'm currently in the Indy Atlantic Melbourne Beach office. But the information we're going over today is important for all people in physical therapy, no matter what. It doesn't have to be physical, you know. Physical therapy is important to anyone who's aging. Just that extra contact is going to mean a lot. So yeah, let's get started. So our goal is to improve balance, treat concussions and whiplash, delay the onset of symptoms for Alzheimer's, Parkinson's, other age-related diseases, treat pain with laser therapy, reduce injuries, and help you love your life. Love your life is our motto at Physical, and it just explains how you can be in a situation and go to physical or go to a physical therapy location and then just feel so much better after and not even realize how much better your life can be after that contact.
Cool.
So today we're, the agenda, just really quick, we're gonna go through the facts and stats, fall prevention, falls and concussions, the safety overhead support system, core strength and breathing, and then Fall Prevention Awareness Month, which is actually in September. Cool. Okay, so just running through the facts, 1 out of 5 falls cause a serious injury, including head trauma. 1 in 4 Americans aged 65 years and older fall each year. Every 11 seconds, an older adult is treated in the emergency room for a fall, which is a lot. That's very quickly. You know, we'll go through many of 11 seconds in our time that we're doing this presentation alone, and that's pretty scary to think about, because if 1 out of 5 are a serious injury, that's a great number. That can be a serious injury.
That's huge.
And every 19 minutes, an older adult actually dies from a fall every 19 minutes. So another really scary statistic to think about. I'm sure we all know other loved ones in our lives that are older, including people that we work with. And that's really scary to think you might lose one every, because 19 minutes.
Yeah, that's like 3 or almost 4 of them in the time that we're going to be taping this.
Right. Very, very scary to think about and sad. And falls are the leading cause of non-fatal trauma-related hospital admissions among older adults. So non-fatal trauma-related hospital admissions include, hip injuries, breaking bones, hitting your head, so anything like that. And falls are the most common cause of traumatic brain injuries, which is the concussion area that we're going to be getting into a little bit later. Concussions are not just for athletes, it's not just for kids playing sports. They can happen at any age, and older adults who fall are actually one of the highest risk groups of people getting concussions.
Right.
And then the last thing, COVID-19 is expected to cause a 30% increase in falls this year.
I was blown away when we were going through this before today. I happened to take a look at these slides, and I was just blown away by that fact. I mean, a 30% increase in falls. How, I think you told me a little bit about how COVID-19 is impacting the falls rate increase. Can you talk to me a little bit about that? In what way?
With COVID-19, people are actually more sedentary. They're not leaving the house. They're not doing what they'd regularly be doing. And not moving actually makes your muscles weaker, and you lose coordination because you're not used to, stepping around objects, just your regular movement. So just the fact of being sedentary is expected to increase falls by 30%, which is something that we're going to have to adjust to, because COVID is such a unique situation. No one knows how things are going to turn out, but yeah, it's expected.
Or how long it's going to last, or what it's going to look like. I know that it does not take long to lose muscle mass when you stop moving.
And the longer you're at home, the longer that COVID lasts, the worse it's going to get. So that's pretty scary to think about too, since it's the unknown with falls. But hopefully, listen to my tips and it won't be an issue. So this is a graph, and It's based on a 2008 or 2007-2008 study. And the important part to note is that there's a steep increase after 65. You can see how quickly it goes up. And that's just because of age, you know, there's nothing else about it, but that's where the intervention comes in with physical therapy, that you can combat that age and actually like keep the numbers pretty steady. And then another thing to note is that it's actually more females at an older age too, but it does increase for both males and females.
Right. I'm surprised that it goes down after 90. Is that because people who live that long just get smarter and pay attention to it? Or
unfortunately, it's not a percent, it's a number of admissions, and I think that age group is less represented.
Okay, cool.
Okay, so this, if you note the red arrows, those are the points where physical therapy can intervene with the causes. So like I mentioned before, Alzheimer's disease, that's something that is a mental health issue. It's a problem with your brain, and physical therapy can actually help change the way that Alzheimer's affects you, and it can help you not feel the effects as much. And the overall weakness and frailty, that's just, you know, working the muscles. Like Beth said earlier, you lose muscle mass if you're not using them. So you got to keep working and got to keep moving those muscles. And then the vision defects, they're actual physical therapy treatments where you're doing walking and you're moving. You're trying to change your physical or your visual field so you can practice, oh, I'm grocery shopping and I'm turning to get something and walking, you know, and that can be really hard for older people. And that's where we see a lot of the falls actually happening. And then the musculoskeletal is very similar to the weakness and frailty. It's about the stiffness of joints, you know, weaker muscles, knees giving out, that kind of stuff, which can be combated with moving your muscles, strengthening them for physical therapy. And then even with stroke and Parkinson's, which are all, you know, just factors of degenerate aging, those can all also be helped with working on your balance and working on strengthening your muscles. And then other factors, so falls, you know, people who fall and then are nervous about falls are 4 times more likely to fall again. So that's a really big factor, you know, that goes up a ton. And just if you're able to combat all those with physical therapy, and you can decrease all of the effects of, you know, the hemorrhage, the pneumonia, the death, the immobility, the mental depression, all of that, you know, physical therapy too, you're socializing, you're getting out, you're seeing people, it helps with the social, it helps with the mental. And yeah, the environment, I think you guys had another caregiver conversation about how to adjust the environment, right? And that's really important too. Yeah, that had some very useful information if everyone has a chance to watch that one as well.
Yeah, and one of the things that I happen to see when you're talking about environment is, you know, my mother-in-law has COPD, and she's has an O2 line that she's connected to all the time. And not only do I worry about her kind of getting all tangled up in it, but that the tank at home that she uses is not right next to where she's sitting all the time. So that cord is kind of just hanging out there, waiting to trip up everybody. So, you know, I mean, I think it's worried because people don't, I think as we age, we don't necessarily pick our feet up as well as we should. We don't necessarily step as deliberatively as we should. And so, yeah, I think a lot of that's related to lack of physical activity.
Yeah, that's definitely, it's often called shuffling, trying to walk with your feet low to the ground, and think about how easy it is to catch your foot on something if you're low to the ground. So that's a really good point. So now we're going to talk about how caregivers can actually help with physical therapy. The first important thing would be the transportation, getting them to and from the physical therapist's office. A lot of times older people aren't able to drive themselves, and without the ride there, they might not even get any of the benefits that we just talked about. And then the next is help supervising their therapy exercises. So usually a physical therapist will give the patient a folder with some homework in it to work on while they're at home in order to keep up their exercises. So supervising those therapy exercises, making sure they're doing them, that's a big thing, doing them, you know, not just saying you did them and then coming back to therapy and not seeing an improvement. But
yeah, you can, the therapist can tell if you're not doing them because from one week to the next, you should be better at it.
Exactly. And then being consistent with the way that everything, the way you treat therapy, the way, you encourage, what you don't encourage with them. You just have to be consistent, and confidence is a huge thing. Confidence in yourself that you're able to help, confidence in your patient to make sure that they know that they are like supported by you, knowing that they can do the exercises, they can get it done. Because a physical therapist is not going to prescribe a homework remedy that's going to hurt the patient. They're going to make sure that they're going to be okay. They know.
When I thought about confidence, I thought about, kind of, being able to imbue that confidence in the person, in your loved one, because they can feel it. If they believe that you believe that they can do it, if that's not too complicated, I think that does make a huge difference. And confidence in yourself that you're going to be able to help them through it will help them make strides forward. So I think, and I just, I don't think it helps to be wishy-washy. Well, maybe we're going to be able to do this. No, we got to go into this. We got this,
So this is just a little picture about falls among older adults in the United States. So like I said earlier, 1 in 4 older adults 65 and plus fall each year. And what we didn't mention before is the cost. It can be $80 billion annually for the United States. That's including everything, the hospital visits, the ambulance, all of that, which are preventable. That's what we're trying to get at. All of this is preventable. So right now in hospitals, that's not a place a lot of people want to be, especially with COVID going on. You want to avoid that at all costs. So if you can do the preventable steps of going to physical therapy locations, you're going to most likely avoid a trip to the hospital.
Always a good thing.
Oh yeah. And hospitals can be there. It's long. It's a lot of paperwork. It's expensive. And
you're absolutely right about it being preventable. It's not a disease. Falls. The ramifications of falls are not disease necessarily as the primary. I mean, those can absolutely increase the chances of falling, but you can do a lot of things to mitigate falls. Falls are very much preventable. It's not like, something that we acquire as far, like I said, as far as a disease thing. We can do a lot to change the landscape around falls.
So concussions and falling, this is something that is not necessarily something people always think about. 8 million people a year go to the emergency room after a fall at home. And that includes everyone, but the larger population is the older people who are falling at home. So, and then falls are the most common cause of concussions. That's so important to think about. It's not kids getting hit in the head at soccer. It's not football. It's falling at home. And concussions are like snowflakes. That's the way I like to think about them, which just means that each one is so different. It's a functional injury, which means that it's not necessarily your bone is broken, your brain isn't broken. It's the way that your brain is able to work. That's the issue. So having a professional to address and diagnose it is the way to go for sure.
Yeah, I was thinking that, most of the time when people think about they fall and they think about a broken arm or a broken hip, concussions are a huge issue that don't necessarily, people say, well, I'm afraid I'm going to fall and break something. And that's, from what I've been hearing and what I've been learning as I'm doing these caregiver conversations, I'm finding that protecting your head is huge. And we did one on the art of falling safely and the major thing that came away with that was to protect your head, that bones can knit and the long-term effects are not as grave necessarily as the things that can happen post-concussion.
Sure. And
talk to me a little bit more about the different kinds of concussion.
Really quick. So, we had patients come in and one of them fell in a grocery store trying to get things off the shelf. And we were like, well, did you hit your head? And he said, I don't remember. I don't know. That's the issue. If they don't remember, that needs to be tested right away. So And that goes into, you know, the symptoms of concussion. It's headaches, nausea, fogginess, trouble concentrating, trouble remembering. If, you know, being knocked out doesn't mean that it was a concussion. There are many other symptoms that lead to that diagnosis.
Mm-hmm.
And physical locations and other locations of physical therapy are actually partnered with CCMI, which is Complete Concussion Management. And that's where we partner with to figure out the dynamic source of figuring out a concussion, which is what I'll be going into now. So with a concussion, this is the graph of what happens. So there's an influx of potassium and calcium, and that leads to the excitatory phase, which is when you're getting all the symptoms of, you know, sensitivity to light and noise, all of that, where initially doctors thought that you should just be laying in a dark room, which now they know is not what you're supposed to do when you have a concussion. And then it leads to a spreading depression, which is where the issues are coming in, that it could lead to permanent effects. You might not be able to get back all those levels if you're not training your brain to get all the correct ions back in.
So let me just stop you right there, Haley. You're talking about it, you know, about sort of the exact opposite of what I'm used to hearing from kind of old school, whereas, you know, well, you're just going to be quiet and you're just going to rest, and you don't want to fall asleep, but you want to rest and you want to not have a lot of stimulation. And you're sort of saying now that the science and the best practices now are saying that you don't want to do that, right?
Yeah. So the thing with concussions are, since they are a functional injury, they are different to each person. So each person is going to have a different recovery plan, but most of the time it does include, you know, you are trying to rest a little, you're trying to avoid, you don't want to go to a concert, something like that, but you still should be trying to work your brain. You should still try to build up those levels back to where they are normally. And I think, if you don't mind, I'll go into the next slide that shows. So this is actually the photo is what's happening at the axon when the concussion happens. So that's the synapse. You can see that the potassium is flying out, and then the calcium's influxing in. There is a large, the potassium ions all leave the axon at the synapse, and then the calcium comes right in. So that actually leads to them firing all the time right away, which leads to all of the, you know, overstimulation in your brain, and then it's nothing after. Since it's a functional injury, structural damage does not always show up on traditional brain scans like they thought. When I was in high school playing soccer and I got concussions, I got an MRI after, and, you know, they might not be able to see the image, the damage on an MRI, because that's not necessarily how it's diagnosed anymore. So then, in order to diagnose it, you need a dynamic multimodal test that measures the brain's functional capacity. And the easiest way to do that is if there's a baseline where the person does all of the tests before to get their normal levels, and then as soon as a brain injury happens, they have markers to get back to show that they're at a healthy level again. But if there is no baseline done, there are traditional levels that mean that you're in a healthy state of mind that physical therapists can go off of.
So it has to do a lot with the chemistry.
Yeah. So pretty much anything that happens in your brain is about chemistry. And it's interesting to think about, like, how an impact can actually affect so much of your brain and so much of what you're thinking. People experience depression from concussions and all of that. That's just insane for me to think about, how it all affects each other like that.
That is really interesting.
So next, we're going to move on to a function that they have in physical therapy clinics. Ours at Physical is called the Safety Overhead Support System. They might call them something different or the same thing at other ones. So it's similar, in my opinion, to like rock climbing. So in rock climbing, you're strapped in, so you know you're not going to fall, but you're still doing the work yourself. You're not being pulled up the wall by the rope. And with the Safety Overhead Support System, you're still doing the exercises. You're still building those muscles, but they're strapped in, as you can see on the photo. So you know they're not going to be falling. You know it's not going to be an issue. And then it allows them to complete their exercises without the risk of falling. So a lot of times people don't challenge themselves because they're scared that they're going to fall again and get hurt. And if you're scared you're going to fall and you're not challenging yourself, you're not going to see in progress.
Yeah, we were talking before about this, and I was talking about the fact that, oh God, a half a century ago, literally a half a century ago, I was I was a teenager, and I did a lot of water skiing, and I happened to be talking with I was probably a fellow back then, and he was a spectacular water skier. We were watching people out on the lake, and I had a really tough life. Anyways, we were watching people out on the lake, and I was mentioning that I thought that guy was a really good water skier because he never fell. And the fellow that I was with said, no, that guy's not as good of a water skier as the other one. Watch the other one over there. And I said, and he explained to me, and his philosophy was, that guy falls all the time, but when he's on, he's so much better because he's always pushing himself to be better and to be more, and you don't really know your limits until so you've got to be able, that exact thing is what happened in my head, is that in order to be able to know how far you can go and where that line is, you have to not be afraid to fall. Now, not being afraid to fall when you're water skiing when you're 13 or 14 is a whole lot different than not being afraid to fall when you're, in your 60s. So, but that's what immediately came to my mind was, you get to a comfort level and you want to stay safe because you don't want to hurt yourself again. So I really think that the overhead support system is really cool.
It's very cool, yeah. And like in this photo, you can see that they're practicing more challenging obstacles. That's a balance board that's not, it's foam, it's really hard to stand on for anyone. And he's on one foot, and he looks like he's doing a great job, but he's safe. He falls either way. Even if the PT can't help him stay up, he's safe. He's not going to be going anywhere.
Yeah, and I imagine it's probably a whole lot safer for the PT person too, because they're not trying to be able to safely lower them to the fall. If they, the number of injuries that happen with physical therapists because somebody is falling and they try to grab them is that's huge. So it's got to reduce workplace injuries for physical therapists as well.
I'm sure, yeah. And off of that too, during COVID, it's less person-to-person contact, which is something I think we're all looking to do right now.
That's true too.
So if you are going to a physical therapist, ask them if they have one and if you could try it out, because I would recommend it. Even if you yourself don't have issues with balance and falling, just try it, see how it feels, so you can explain to your loved one what it's like and how you're safe. Because the best way to explain is if you've done it, for sure. Okay, so this is actually a photo of someone in our clinic using our safety overhead support system. And you can just see that's a patient who had Parkinson's or has Parkinson's, and he's doing great. He's able to do everything on his own. Wow. And that's really something special to see. Okay, so next we're going to move on to core and core strength. So a strong core, which is, all the muscles in your stomach, back, your trunk pretty much, increases or improves balance, posture, lower back pain, and helps with athletic exercises such as, golf, pickleball, swimming, all of those that are lifetime sports. It also means a strong diaphragm. And for those of you who know, the diaphragm is the muscle right there. And it's on the inside. It helps with your breathing. So the benefits of a strong diaphragm, it lowers your chance of injuring or wearing out your muscles, helps lower blood pressure, lowers heart rate, lowers the harmful effects of your stress hormone cortisol in your body, and it headlines the breathing, which is what it's supposed to do, instead of compensating with your other muscles, your neck, your back, your chest, which is where people often end up feeling pain in their lives because they're stressing them when they're not supposed to be. So today we can run through a quick diaphragmatic breathing instructions. This is how you can help improve the strength of your diaphragm. So sit comfortably, relax your shoulders, put one hand on your chest and one on your stomach. Breathe in through your nose for 2 seconds. purse your lips, and breathe out for 2 seconds. And then you repeat that. And I think Beth and I had a conversation about this earlier. It's not the deep yoga breathing where you're breathing in for 10 seconds. And it's a quick, short breath that's going to, be a different motion in your lungs. And it's going to help build that muscle, which will help with all the things that we talked about before.
That's pretty cool.
So hopefully everyone got a chance to do that when we were sharing this. I would recommend it for sure.
Very cool.
So now this September, or all September, but this month right now is September, is Fall Prevention Month. And we aim to prevent falls across all age groups, but specifically in elder people. I know at our clinic, Ginger is geriatric certified, so that's a big thing for her. But a lot of therapists down in Florida are concerned about older adults falling. And falls are costly, have a lengthy recovery, as we talked about before, but they are preventable. And that's what we're working on, preventing the falls, preventing the lengthy recovery, preventing all the costs, out of all the hassle.
Mm-hmm.
So most of us know someone who has trouble with balance or experienced a fall. And it's more than just aging. So my mom has issues with falling just because her inner ear balance is off. She doesn't necessarily have vertigo, but vertigo is a sudden sensation of spinning, dizziness, also it's inner ear dysfunction. So you have crystals in your ears that help with balance, and sometimes they're just off for people, and that needs some help retraining.
Yeah, I know that one of the things that, if you stand up too quick, it's the long phrasing for that is orthostatic hypotension. But that's where you just don't catch your balance, your body doesn't catch up with where you are. And so your gyroscope in your inner ear that you were talking about, it gets whacked, and that can absolutely cause dizziness.
Yeah.
And so, yeah.
Yeah, it's
and that can happen at any age.
Exactly. I get it if I'm laying down too long and I sit up very quickly, and I'm in my young 20s. So it's something that everyone needs to think about no matter what.
Yeah, and we're talking about when we were talking before about falls. When I was lucky enough to not hurt my head, but when my son was just before my son got married, like the day before my son was getting married, I was out walking and I rolled my ankle and broke a bone in my foot. And you wouldn't have thought that it was actually caused by weak muscles, but that's what it was my ankle muscles weren't strong enough. And it broke a bone in my foot. And I was in my 40s when that happened. So,
Yeah, you never know when, my mom's rolled her ankle in the yard. She's fallen just walking around. It just happens to some people. And if it has been happening to you, then, I would come in for what we're about to go into, a free fall risk assessment. FYZICAL is offering them all year at Melbourne Beach and the other locations, I believe. So you want to look at this quiz that says if you're susceptible to falls, pretty much. So you're only going to score your yes answers. The first two are worth 2 points. Everything else is worth 1 point. And if you're past a 4, you really should be going in for a fall risk assessment. And then there's information there. And we are also doing drop-in assessments, open hours from 11 a.m. to 1 p.m. next week, which is September 21st to 25th. If anyone's interested in doing that, would love to have everyone, with as many people as possible that we can help. That's really the goal. And yeah, these are my sources. This is the map of actually all the FYZICAL locations in Florida, if anyone is interested in those. You can see us on there in Brevard. There's another one in Brevard, which must not be on there yet, off Wickham Road. And then, yeah, just all over. They're actually a national franchise. So I'm from Massachusetts. There's one in the town next to me in Massachusetts. They have all across the world, or country. And then, yeah, this is just our information. If anyone has any questions or would like to come schedule an appointment or come see the safety overhead support system, would love to just show you what it's like. That's our location. So feel free to contact us.
Cool. That's so great. So thank you very much, Haley.
Thank you, Beth.
It's been wonderful. And we will. And again, if anybody would like to be able to contact Haley and the team at FYZICAL, the phone number is there. You can also get a hold of me at Sunflower House. And I thank you very much for a wonderful caregiver conversation, Haley.
Thank you. Thank you so much.
All right, we'll talk to you soon.